All right, we're going to go ahead and get started. So welcome to the webinar on expected and parenting youth in foster care. I'm Tamara. I am the Expected and Parenting Youth Specialist in the Child Safety and Permanency Division here at the department. Just a few housekeeping things. You will not be able to unmute yourself. And the slides will be available during and after the webinar. We have put the link in the chat, so you should be able to access the slides there. And then we ask that you put your questions in the Q&A function and not the chat. We want to be able to track the questions, and that's the best way to do so. And then just the final piece, this presentation is being recorded and will be available for future viewing. These are the presenters that we'll have today. So it will be myself, Eric Kratt from the Training Academy, and Amber Buckner, who is from our 4E unit. All right, so we'll start off with just the webinar objectives. We are going to look at the population, define the population, and provide some information on new SSIS documentation. And we will also provide some information on the Ffpsa residential care changes, which I'm sure that's why a lot of you are here. And then we'll introduce some guiding principles when working with expected and parenting youth. All right, so just a little bit of data. So this data was obtained from the Department of Health from the birth records. And so I've been looking at the population of young people in the state. And so as you can see, these are the numbers of females ages 14 to 20 in our general population. So this is just general population, no child welfare involvement. And these are the counties with the highest number of births in the last 3 years. So just kind of give you a picture of who we're talking about and what counties may be impacted more so with the new services for pregnant and expecting youth. On the next slide, so we begin to look at the child welfare involved births. So we're just looking at births at this point. So these are the birth numbers for the last 3 years, that top row there. And if you want to look at pay attention to the bottom row there, that's the number of CP victims after birth. So those are the parenting youth that are involved in child welfare. And then we'll look at the number of young people in care. So these are the numbers of care in the last 4 to 5 years. And then looking at the number of parenting youth in care and the number of pregnant youth in care. Just one moment here. All right. So all the data here that excludes pregnancy data and data on expecting and parenting fathers in care. And so once we get things going in SSIS with collecting this data, our numbers will be much more clear and will paint a better picture of the young people that we're talking about and who will be eligible for these new services. We'll go on to the next slide. So when we're talking about expectant and parenting youth, we're talking about pregnant youth, expecting fathers, and parenting mothers and fathers. And so ASCARS mandates data collection, and then Ffpsa mandates services for pregnant and parenting youth. And so based on the feedback from the two Ffpsa work groups on pregnant and parenting youth, we have decided to be inclusive of expectant and parenting fathers whenever possible. So this is why we're using the term expectant in parenting youth. So now we'll transition into talking a little bit about the Ssis documentation. So as I stated, AFCARS and Ffpsa require specific elements for expectant and parenting youth to be documented. And the elements were added throughout Ssis on new data screens and embedded in the out-of-home placement plan. So the first thing we'll cover here is the new EPY or PPY screen. So this new screen became effective last September of 2020. And it applies to all youth 10 years old and older with a continuous placement starting on or after 9/1/2020 of last year. And a completed screen with the last reviewed date occurring in the last 6 months is required for all youth in out-of-home placement. And so in efforts to be inclusive and support expectant and parenting fathers, it became the EPY screen as of 9/15 of this year, so just last week. So we will now be identifying pregnant youth, expecting fathers, parenting mothers, and parenting fathers. And so on the next screen, we'll take a look at the, this is just a screenshot of that new screen. So this screen is located under the person node, and these are the fields that would need to be completed. So has the youth ever fathered or bore a child? Yes or no? Is the youth parenting one or more of their biological children? Or is the youth expecting, so either pregnant or expecting father? And so, what is the expected due date of the baby? And then the last review date, and then the create date is automatically generated. And then there's a text box for additional relevant information. So this next slide here is on the Ssis certification for the PPY residential placement. It'll kind of make sense more when we start talking about the residential placement and how to connect things and such. But in order to qualify for a Title IV reimbursement for a residential placement for pregnant parenting youth, you must document the applicable setting and reason. So for the setting there, you want to select group home, staff operated or residential program. And then the reason, selecting pregnant and parenting youth. And that applicable certification, you want to select PPY. And on the next slide, we'll look at how to link the existing PPY record to the PPY residential placement. So this is done in the permanency folder under a continuous placement, as you can see circled there. And then you want to, again, select the reason for the placement. But just a reminder that there should be no placement solely due to expecting or parenting youth status, only if residential care is in fact needed for both the young person and their children or their child. So when creating a placement plan with pregnant and parenting youth, you must add the existing PPY link to the plan in order to qualify for the Title IV reimbursement. So you want to use the action menu button at the bottom there to add existing expectant and parenting youth record on the placement screen to create a link to the supporting documentation. All right, so now we'll go into a little bit of on the out-of-home placement plan changes. So agency efforts to meet the needs of expectant and parenting youth are documented throughout the revision and enhancements of the out-of-home placement plan in these sections. So in the setup screen, placement decisions, youth service provider details, the foster provider detail, and then the new expectant and parenting youth detail, which we'll talk about. And so now we'll begin with the out-of-home placement plan setup screen. And Eric will demonstrate that for us.
Hi, folks. As you may recall from the out-of-home placement webinar, we walked through how to do the setup tab on the new out-of-home placement plan itself. And so the link that you're seeing on this particular slide and the presentation has been put into the chat. So if you wanted to click on that link and go about halfway through the document, you would be able to see the new specialty questions that have been added for the EPY information. I've also included a handout for you that has also been linked in the chat, and the information for the expectant and parenting youth in an out-of-home placement plan starts on page 6. So you will see the new youth is expecting or parenting question, and individuals will be able to select yes or no to that question. And if the answer to the youth is expectant or parenting, if that answer to that question is yes, then some fields will appear in the document portion of the out-of-home placement plan. And if we want to go to the next slide, I can show you what the title page will look like if the answer to youth is expectant or parenting is answered yes. So in the top left-hand screenshot, where you see the grid view of the child's name, age, plan start date, underneath that you'll see whether or not the independent living plan is included for youth who are 14 years of age or older. And the formula actually in SSIS for that is individuals who are 13 and a half and older. So the ILP will be included in the out-of-home placement plan. But the focus of today's webinar is that expectant or parenting youth question that you'll see underneath the independent living plan. And again, if you answer yes on the setup tab, you will see a corresponding yes on the title page of the actual document. A couple of other things on the title page to pay attention to are the alleged parent relationship to the child is included in that bottom, the top right screenshot. So you can include alleged parent relationships to be inclusive of fathers on the title page as well. So if we go to the next screenshot, if a placement is entered into SSIS, the red arrow is showing that placement setting. That is going to interface into that checkbox, or I'm sorry, that placement setting field as the type of placement setting. So for instance, in this example, it's group home staff operated, otherwise it might say residential facility. If you have not entered the placement into SSIS, there is an other field where you can describe the placement, to describe the placement. And then Tamara is going to go over some more of the screens that have been added for expectant and parenting youth on the out-of-home placement plan in the following slides. So I will hand it back over to you, Tamara.
Thanks, Eric. So as I mentioned, there are various sections of the out-of-home placement plan that specifically identify the needs of expectant and parenting youth. And we'll start with the best interest factors. So there must be additional considerations for expectant or parenting youth, youth who have been or are at risk of becoming victims of sex trafficking, youth in a placement in a substantial distance away, and religious preferences of a parent, amongst other things. So on the next slide, you'll see that there's a space for a narrative to identify the child's individualized needs in each area and how the placement setting will help meet those needs. On the next slide, so some things were added for the details. So in previous out-of-home placement plans, there was not service detail for the provider, and efforts to support foster care providers weren't documented. They were documented in the placement stability section. So this is a change. The revised needs list includes detail on services for youth that are expecting or parenting, cultural or tribal specific resources, social or cultural or tribal community needs, and again, addressing if youth have been exploited or trafficked at some point, and providing some support and prevention services for them there. And this is the expectant or parenting youth detail. So this is a brand new section. And this section documents the expectant and parenting status of the youth. So in a future release of SSIS, there will be a function to have this autofill, this portion of the plan of the status, autofilled from the EPY record based on the setup options. But until then, we'll have to manually enter those few questions about the EPY status. This section also addresses reasonable or active efforts to prevent the placement of the child of the expectant and parenting youth. So we want to take a look at specific prevention services or interventions, and the agency's efforts to locate and utilize culturally or tribally appropriate services, and the agency's efforts to engage the other parent of the parenting youth child. So we will also need to document the location placement detail of the child of the parenting youth, and provide a description of the specific reason why the youth and the child are not co-located together, if that applies. And just a reminder that if an agency has placement authority of the youth child, they will have their own separate out-of-home placement plan to address these needs. And so this is mainly for if a youth is in care and their child is not in care, but physically located with them, or maybe not located with them. So this is a screenshot of the EPY detail. So again, the EPY status, and then the efforts to prevent placement of the youth child. The next screenshot is on the location and placement details. So you'll see some boxes at the top there, identifying if they're located together or not, and if there's placement authority for the youth child or not. So checking the applicable boxes, and then a space to describe the specific reason why the child and youth are not co-located together, if that applies. And so there's also a section on the healthcare and education providers of the youth children. And so this section is an additional case plan tool to support meeting the needs of expectant and parenting youth and their kids. And it also supports the coordination of health services and support for the youth children. And it also aligns with the efforts to prevent child welfare involvement and placement of those kids. So this is just a screenshot of that portion of the plan. And then we'll go into the EPY rights. So in this section, this is a new section added to provide information about the rights of expectant and parenting youth. It includes youth rights to consent for personal, medical, mental, dental, and other health services and non-health services for their children. It also documents that the youth has been informed and given a copy of their rights, and there's space for a signature as well. Additionally, young people should be seeing their kids, and there are some contact and visitation expectations. And these are the expectations if the youth and their offspring are separated and not physically located together. So the agency is expected to provide visitation on or other ongoing interaction between the separated parties. The exception is if an agency has documented that this type of interaction is contrary to the safety or well-being of any of the parties. And then a youth access or participation in visits cannot be withheld or restricted based on consequences for behavior. So that sums up the new pieces in the out-of-home placement plan that specifically address the needs for expectant and parenting youth. And now we'll go into pregnant and parenting youth in residential care. So we'll start with a little overview of PPY or of Ffpsa. And if you were in any of our other webinars of the series, this is not new information. So the Act became law in February of 2018. It modifies many sections of federal child welfare laws, including 4E. Most significantly, it strictly limits federal reimbursement for children's placement in group residential settings by establishing new criteria for congregate care facilities. In Minnesota, the modifications to residential placement are effective 9/30/21, so just next week. And then this also creates new optional Title IV prevention services for children at risk of entering care or those young people in care that are expected in parenting in the area of mental health services, substance abuse treatment, and in-home parenting programs. And these programs have to be Title IV approved through the clearinghouse. This work has a later implementation date, but we are working on this piece of Ffpsa as well. So just a quick recap. The Act's purpose is to change 4E in order to enable states to use funding for prevention services and to encourage the use of family foster homes as a primary out-of-home placement solution. And then to limit the use of congregate care settings by increasing requirements for placing process and the eligible facility types. So just a few things. Foster residence setting changes due to Ffpsa. So when this is implemented, the MAPC no longer applies to foster residence settings. So those commonly known as corporate foster homes. These settings must be considered children's group residential facility for Title IV purposes. So Ffpsa defines Title IV eligible settings, and for congregate care settings, federal Title IV foster care payments are limited to 14 days, except in the following 4 settings. And a pregnant and parenting youth setting was one of those 4 settings. So those settings for young people who have been at risk for sexual trafficking or commercial sexual exploitation, those supervised independent living settings, and then Qrtps. And then also programs and facilities may have multiple certifications. So whatever they see fit as the population, for the population that they typically serve. All right, so the PPY setting in particular. So parents and youth and their children should be co-located whenever possible. And such a setting helps to make that co-location possible. The programs will provide prenatal and postpartum support as well as parenting support and education. And then these programs are for pregnant youth, parenting mothers, or parenting fathers. And so on the next slide, you'll see kind of a visual of the Ppy setting eligibility. So notice the change of terminology when we're talking about one of these facilities. These settings are only available for pregnant and or parenting youth. Thus the change from expecting youth to just pregnant and parenting youth, if that makes any sense. So that's why we use the terminology Ppy when it relates to these residential placements. So we'll go on to talk about the considerations for placement in such a setting. So the best interest factors still apply, and the agency must assess the needs and the best interest of the youth and the children and decide if their needs can be met in their home or if out-of-home placement is necessary. The agency must also ensure the county or tribal social service agency has placement authority. So the agency must have placement authority through either a court order or a voluntary placement agreement. And again, this should be a given, but youth must not be placed in foster care solely due to their pregnant or parenting status. Also, the agency must determine if the youth and their child's needs can be met in a family foster home setting. The preference is for placement in a family foster home or in kinship placement. And if their needs can't be met in a foster home, then we want to think about referring to a Ppy residential setting. And again, in the step of the process, you have to document that Ppy status on the new EPY screen in Ssis so that that link, that record can be linked to the placement, if in fact you are doing this kind of placement. So just a couple other things, reminders about making this placement decision. Children may have individual needs that fit into one or more setting types, and then you just kind of have to figure out which is the best fit for the young person. And then also, Ffpsa does not change any ICWA or MISPA requirements. So again, this is the basics of what these programs will provide. And the biggest piece here is the programs will provide education on safe bathing, safe sleep, and reducing the risk of sudden unexpected infant death, and education on abusive head trauma from shaking. Additionally, the programs will provide assistance in accessing or providing sexual reproductive health services and education, and assistance accessing postpartum mental health assessments and follow-ups. So that's a snapshot of what the programs will provide on a basic level. And so we'll transition into talking about the placement process. All right, so due to the new Ffpsa placement process, case managers, social workers will need to be aware of the facility, of their licensing and their certification prior to the placement. This is going to be very critical. And so the next slide is a screenshot of the licensing information lookup database. This is where you will go to find the licensed children's residential facilities and what certification each facility has. And then the same thing for those foster residence settings, commonly known as the corporate foster homes. Next slide, please. All right, so this is the basics of the facility process. The facility must obtain Title IV-E approval and get certified by licensing. The requirements for the certification are a part of the Human Services Licensing Act that will be in section 245A.25. And those requirements are currently available in the Minnesota session laws for 2021. And so next we'll go into a little bit about the Title IV-E requirements, and Amber will walk us through that.
Thank you, Tamara. I am Amber Buckner, and I'm from Title IV-E at DHS. So the Title IV-E basics are that it's federal reimbursement for foster care maintenance payments for eligible placements in eligible settings. And the reimbursement is made to county social service agencies and child welfare initiative tribes.
Hey, Amber,
Can you
can
hear
you
me now?
speak up? Yeah, we're having a hard time hearing you.
Can you hear me now?
Much better.
Okay. All right. All right. Sorry about that. So I'll start over. Um, so I'm Amber Buckner, and I'm from Title IV-E at here at DHS. And the basics of Title IV-E is that it is federal reimbursement for foster care maintenance payments for eligible placements in eligible settings. The reimbursement is made to the county social service agencies and child welfare initiative tribes. And so the counties and tribes report the eligible placement to the state, and then they are reimbursed. And the counties and tribes must verify children are placed in eligible settings in order to receive the reimbursement. Next slide, please. Thank you. Um, so the process for certification and for approval. First, DHS licensing will issue certifications, and DHS licensing will review the requirements for the programs and facilities licensed by DHS, DOC, counties, and private licensing agencies, which include foster residence settings. The applications for the new FFPSA certifications became available on June 30th of 2021. Programs and facilities choose whether or not to seek these certifications. Programs and facilities may have multiple certification if the design of the program or facilities are appropriate. There is a phased process for Title IV-E claiming. So programs and facilities that are currently eligible for Title IV-E reimbursement will need to become certified for one or more of the 4 new setting categories. And when the programs and facilities have received the certification, the licensing staff notifies someone in the Title IV-E division. And no additional information will be needed for the programs or facilities to remain Title IV-E eligible. For the programs and facilities that are not currently Title IV-E eligible, the programs and facilities are required to obtain certification from DHS licensing for one or more of the specialized settings. The county submits the following items on behalf of the program or facility to DHS financial operations at the email address listed on the next slide. So the counties and tribes would send in the DHS 2825, which is the Notice of Contracted Per Diem Rates. They would send in the PPY checklist, which is the 8138. And they would send in a copy of the license for that program or facility, as well as a description of the program for the services that they provide. And there is an expedited process in place for those programs and facility that are currently approved for Title IV-E that have already been certified by one of the national accrediting agencies. To obtain Title IV-E approval, when the program or facility meets the requirements of the FFPSA settings and has a lead county has a lead county contract in place, the placing agency may apply for the facility's Title IV-E approval. Financial Operations, or FOD, will provide information about how the Title IV-E foster care per diem rates and percentages report will be modified, about the information concerning the Title IV-E approved foster care residence settings. And if you're not familiar with that report, you can see that report at this link right here, and you just go to County Link, Fiscal Reporting and Accounting website. Just a little louder, okay. The facility certifications. The certification standards are in Chapter 245A, and certification standards, in addition to existing licensing requirements for children's residential facilities and child foster residence settings or corporate foster care. DHS will issue certifications and review the requirements for programs licensed by DHS, Department of Corrections, counties, and private licensing agencies. Programs choose whether or not to seek these certifications. Programs may have multiple certifications if the design of the program is appropriate.
All right. And now we'll go into the details of the PPY facility requirements. So to be certified as a residential setting specializing in prenatal, postpartum, and parenting support, the license holder must collaborate with the social service agency and other parties to implement the youth out-of-home placement plan. So that's one of the first basic requirements. Additionally, the license holder must specialize in prenatal and postpartum services, and again, have to assist the youth with accessing postpartum services for at least 60 days postpartum. So that's about 2 months postpartum, at least that. Additionally, the provider has to provide equitable and culturally responsive and individualized services, so taking those things into consideration. And the license holder and the facility must engage with discharge planning for youth and their families when appropriate. So then going into a little bit about the details of the certification requirements. So on or before the date of the child's initial physical presence at the facility, the license holder must provide education to the child's parents, to the adolescent, about safe bathing, reducing the risk of sudden unexpected infant death, and abusive head trauma. This may occur throughout their stay there, but this is also a requirement before the baby or the child even gets to the facility. The next piece here is that the license holder must document the parent's receipt of education and keep this documentation in the parent's file. And then the documentation must indicate if the parent agrees to comply with those safeguards. And if for whatever reason the parent refuses to comply, the program staff have to provide additional education as described in a parental supervision plan. Next slide, please. That just talks about that, the safety and documenting those things. Let's see where we're at. So go back to the last slide. So there's another piece there. So the license holder must also document the parent's receipt of the education and documentation. There's another piece that I wanted to say about this. We can go ahead. We can go forward. Sorry about that. Okay, so on or before the date of the child's initial presence, again, the facility must consider and document the parent's capacity to meet the health and safety needs of their child while on the premises. So just considering the health and the physical health and mental health of the adolescent, if the parent being under any influence of drugs or alcohol or medications or other chemicals, and then any other information available to the license holder that may indicate that the youth isn't able to adequately care for their child. And again, on the next slide, it just says that this must be documented. And if a parent refuses to comply with the safeguards, again, the license holder must develop a plan in conjunction with the youth. So additionally, the license holder must have written procedures to address if the program allows for a parent to arrange for another youth in the program to babysit their child. So we know this is pretty common in these kind of settings, or amongst young people too, right? So if permitted, the facility must have a procedure that requires staff approval of the supervision agreement before the supervision actually occurs. And then again, the procedure and approval must be documented. All right, so the certification process. So those were the requirements that are outlined in statute. So if a program decides to go above and beyond that, great. But those are the basic requirements. So now we'll go into the DHS certification process. So DHS is accepting requests for certification, and the certifications will be added to the children's residential facility or the foster residence setting license. Licensors will review information submitted to DHS by each program that chooses to be certified to verify the program is able to meet the certification standards. And so DHS will monitor these programs to ensure that the standards are being met during the regular licensing review for DHS. And then the programs licensed by the Department of Corrections or counties or private placing agencies, they will be reviewed for only the certification standards by the DHS licensing division. And then any non-compliance with the certification standards may be addressed in a correction order, or the program may be decertified. And if the program is decertified, then there won't be any Title IV reimbursement for that placement. And also, non-compliance with the new certification standards will not be included as grounds for a conditional license. So, a few next steps. So, as we have stated over and over again, which we're really excited about, Minnesota opts into Ffpsa on September 30th. The new Title IV requirements apply to placements after that date. And so a child in a current placement will be considered a legacy placement. So you'll hear that terminology. And then there will need to be conversations amongst the county or tribal agencies and the facilities about what all this means and what these requirements entail. And then the foster residence setting must establish a lead county contract to be eligible for the certification. So those are the next steps with the residential placement. So now I want to introduce guiding principles. These guiding principles were developed by an Ffpsa implementation stakeholder work group. They help to identify the needs of youth in care that are expectant or parenting. And the following are suggested principles for workers to consider to guide their approach when working with these youth that are expecting or parenting. And so we'll just get into a little bit of them, some basics. So for connections, making sure that you cultivate and support the youth connections with non-paid supportive adults. For cultural competence, striving for cultural competency for yourself, right? Being aware of one's own worldview and learn about different cultural practices and worldviews. And then developmentally informed. It's ideal that the worker becomes informed of adolescent and early childhood development stages, and then help the youth understand their development. as well as the development of their children. And holistic, we would like for folks to approach the work with the youth in a holistic way by considering the total of the youth and being aware of all aspects and influence of the youth, so their mind, their body, their soul, their environment, their social structure, all those things. And then support and provide services for both the youth and their children in a whole family wraparound approach. And then for positive youth development, it will be ideal to provide youth with opportunities for development that are aligned with positive youth development approach and engage youth in ways to empower them to reach their full potential. And for prudent, it's ideal that the worker provides the same opportunities for youth who are expectant or parenting and in foster care as youth that are not. And that, and then to be sensible and practical when making these decisions for the young people based on their age and development. For strengths-based, it's ideal that the worker focuses on these strengths such as asset, positive attributes, and the resiliency that the youth brings into the situation. And of course, trauma-informed. We always want people to be trauma-informed, understanding the different ways trauma affects youth in foster care. And again, promoting family unity amongst youth and the child's other parents. So considering that piece too. They may not be together in an intimate relationship still, may or may not be, but promoting that family unity. And so more details and suggestions about how to do these things will be provided in a practice guide that will be published soon here. We can advance the slides here. So just some of that basic information about what the expectations are. You can advance the slides. Here's just some additional resources. And now we'll go into questions. So we'll try to answer the questions in the Q&A that are there. And the questions that we may not be able to get to will be added to the FAQ and posted at a later time. So we can go ahead and stop sharing and take a look at the questions in the Q&A. All right, so a couple here. Please clarify, a completed EPY screen is required every 6 months for every youth in out-of-home placement or only for youth who are expectant or parenting and in out-of-home placement? An EPY screen is required for all youth in out-of-home placement that are 10 years or older. So if it doesn't apply to them on that screen, you want to click no, and then the other areas will be grayed out. And you won't have to update it for another 6 months.
Can I add on to that, Tamara?
Yeah, please do.
So you can set a reminder for yourself in SSIS or using any other reminder tool that is available to you at your agency to go back and visit that screen for individuals who are in out-of-home placement, because you will receive a data cleanup if that screen hasn't been reviewed within 6 months of closing that work group. So I just wanted to add that to your response.
Thank you. And then do we know how many PPY facilities are in the process of certification? The last time I checked, there could have been a facility that was applying, but we won't know which facilities or if any facilities are approved until they are listed on the licensing lookup website that we discussed. So that's how we'll know which ones are certified and approved for the PPY setting, the SEY, SCSEY, the SIL, or the Qrtp. So all those specialized settings. That's how we'll know which facilities are licensed. And if you know that you data indicates that there are a lot of pregnant and parenting or expectant and parenting youth in your area, then, you know, this is something that you might want to get ahead of and begin having those facilities apply for the license. So look at the questions here. All right, I lost my questions, pulling them back up. Okay. Oh, again, we have a question here about, are there any facilities that are currently approved for Qrtps? And those will show up on that licensing lookup website. And that website, that database is updated daily. So we will know in real time which facilities are licensed. And right now, there are not any residential programs for PPY that are certified. And so we'll be waiting to see what facilities apply for the certification. There's a question, is anyone reaching out to agencies about this, or what does the communication with residential programs look like? We have been in connecting with the residential programs for over a year now, as we've been preparing to implement this. But the primary thing is going to be that relationship between the counties or the tribal agencies and the facilities in that area. Again, so if you know there's a lot of young people that are expecting or are parenting in your area, you want to make sure that there are some facilities that are licensed to provide service for them. All right, let's see. If a child turns 10 while in placement, do you do an EPY screen at that time? Yes, you will need to do an EPY screen if the child turns 10 and is in placement, any kind of placement. And I'm going through questions here. You guys have a lot of questions. This is great. Since these requirements come into effect next week, what are the suggestions for placements if we do not have any PPY placements? That's a good question. So, I mean, you would do as you would do with, you know, any other placement pre-Ffpsa. So we would want for them to have services in their home if they could, and then considering those foster homes or kin placements if possible. And then if you are finding that the needs of these young people aren't being met in either of those settings, then that's when it's critical for your county or your agency to reach out to these facilities in the area to begin to get them certified to serve this population.
Tamara, can I add a little bit to that? This is Deb Besky-Brown.
Please do, yes.
Just a piece about this does not create a preference for residential placements, but rather requires the agency to look at the needs of pregnant and parenting youth in any setting. And you still want to look at family settings, doing relative search, and certainly if a child needs chemical dependency treatment, is there a treatment setting that might meet that youth's needs? I don't know if the SUDs that do co-location of a child and a baby is available for a child as young as 16. But certainly for older youth, that would also be something to consider. But this is a new option that's available for residential facilities, and it's a developing option. So just because there is not an option today doesn't mean your agency still should be looking at it and having conversations with your residential facilities about the option to meet this need for those youth that you know. So I really encourage those conversations to start. And I apologize if you're hearing the noise at my house. I'm having a new roof put on and it's very noisy right this second.
Well, thanks for being here, Deb. Thanks for jumping in. We appreciate it. All right. Were there any questions that were in the chat, perhaps, that I missed? I know there's a couple more in the Q&A, but just making sure we're not missing anything that was accidentally placed in the chat.
Did we answer the last question, Tamara, about the chips?
No,
and if
we did
both
not
the
address
minor
that.
parent and the minor parent's child, can the county place with the parent and still be considered foster parents? I'm not sure. So if you're thinking, could the baby be placed with the minor parent, that would be considered a trial home visit if you have custody of the baby. But you can't place a baby with a minor parent who's in foster care. I don't know, does that making sense?
Yes, I see. Yep, exactly. So if the question is, if the agency has a CHIPS case on both the minor parent and the minor parent's child, with the agency having custody of both, can the county place with the parent and have it still be considered foster parent and make payments? So as foster care definitions state that the living with a parent or is not considered foster care. So there may be a situation, yeah, it would have to be trial home visit. Or yeah, so the minor, actually I'm going to look into some federal guidance on this question and place this question on the Q&A. So whoever posed this question, there will be additional guidance on the Q&A that we'll post in a later time, in the near future.
Tamara, this is Deb. I can just add to this that we don't make foster care payments to a parent when a child is in a trial home visit.
Yes, exactly. All right, the other question, if a parenting youth were to be placed in a young mother supportive housing program with her child, would the parenting youth be able to receive foster care payments? Or would the program receive those payments? This specific program is stating that they have had youth in foster care placed there, and the youth have received their foster care payments, but our county is unsure how this is possible. So there's lots of scenarios where these housing programs have had young people there. And if the young person is 18 or 20 and in extended foster care, then they could be in this place in these supportive housing settings. And then they will get the young person will get the payment directly. The housing program will not get the payment directly if they're not certified as a PPY setting, as a foster residence setting. Anyone else want to add anything to that?
Well, Tamara, of course I do.
Yes.
just to note, Tamara, that 16 and 17-year-olds must be placed in facilities that are licensed unless it's an emergency relative placement. So a 16 or 17-year-old that the agency has placement responsibility for can't be placed in an unlicensed facility by the agency. So if the agency has placement responsibility, they must place in a licensed facility. And again, this PPY certification offers a new option for those residential facilities to provide this service and maybe serve a 16 or 17-year-old who is pregnant or parenting and meet those requirements. So I just really think this is a new option that we need to consider for our youth, and to consider how our current programs may be able to provide this service in a different way. Thank you.
Thanks, Deb. So that's it for the questions that I see. And as I stated, we'll try to get these responses written up for you all and attached to a FAQ on our website. And I think that's it for the questions. I'm double checking the chat again.
Yeah, there was some follow-up on certified facilities from Maxie Rockymore. And then some information from
okay,
Laura
an
Brandt.
update.
Yeah.
Great. So yeah, Maxie says that there are about 9 facilities, programs that are currently applying for Qrtp, and 4 that have applied for PPY. So this is great news. But again, we don't know which ones we don't know which ones are approved until they are on that licensing lookup database. So another one, based on my knowledge, you cannot approve a supervised independent living setting for 18 to 20-year-olds that has 24-hour staff. So this is a change. And then there will be another webinar on the supervised independent living settings and those parameters. I believe that is next week. Nick Vogel will be doing that one, and he'll be able to go into more details about those supervised independent living settings. All right, I think that covers it. Well, thank you all for attending. We do have maybe 1 or 2 more in our series of webinars before implementation. And these webinars will be listed on the Child Welfare Training Academy website, and you will be able to view the recordings, look at the FAQs, get the PowerPoint there. And if you have any particular questions, feel free to reach out to me. My email is listed on the PowerPoint. Thank you very much, Nicole. Look at the team, just posting everything in the chat. Go team. So yeah, that concludes our webinar today. Thank you all for joining us.